Hey everyone, I'm Dr. Gord McMorland, one of the chiropractors that works here at National Spine Care and Sports Med. Wanted to chat briefly about a common thing we see here in the clinic, and that's back pain or sciatica, where we suspect there's a bulging or a herniated disc. There's been some concern that chiropractic treatment may not be safe if you think there's a bulging or herniated disc causing the back pain. I blogged about this where we reviewed a recent article that came out in European Spine Journal. So you can read more about that, but the authors concluded that chiropractic treatment is completely safe for that condition. However, I wanted to get into it a little bit more because oftentimes when we see a patient that has either a herniated or a bulging disc, they're worried that when they see a chiropractor, there may be some treatment that uses quick movements like a spinal manipulation where they're going to crack your back and there's going to be a lot of force, and that could result in further injury to the disc, and sometimes that could even go on to surgery. So oftentimes when we see a patient where we either suspect there's a bulging or a herniated disc, or we know because we can see it on the MRI, we'll use a treatment that involves this table. It allows us to put a little bit of tension or traction on the low back. What that does is it takes the pressure off the joints. One of the problems you have when you have a lot of back pain is the muscle tension creates compression on the joints and doesn't allow those joints to move properly. And then what we do is we take a page out of Robin McKenzie's book. He was a famous physiotherapist out of New Zealand that recognized there's certain positions and movements that will either make the disc problem and the pain and sciatica worse, and then there's other positions and movements that can make it better. And it's what's called peripheralization or centralization of your symptoms. So we use that phenomenon to gauge which movements and positions that you should be in or start to do to try and heal the disc problem. So the way we do that, peripheralization means that any position or movement that peripheralizes or makes the symptoms go further down your leg, or the intensity of the symptoms further down into the periphery, is a bad thing. And centralization is the opposite, meaning any position or movement that might make the pain come out of the periphery or the leg and centralize into your buttock or back. So we use this table to put a little bit of traction on your back, and then we just slowly start to introduce some movements into your back. It's done very gently and slowly, and we get you to tell us whether the pain is improving, meaning it's centralizing, or getting worse. And that's how we gauge which movements you're going to need to do when you get home to try and help heal your own back. So I hope that helps you understand a little bit more about what might happen if you come and see us or see a chiropractor for back pain or sciatica when there's a suspected bulging or herniated disc. Likely wouldn't involve someone just cracking your back. There's a lot more gentle ways to go about trying to help you out.